Forget the long pants. You can actually show off your legs for a change. We're at LAVE MD with Dr. Vanderpool, and he's going to tell us about the latest in varicose vein surgery.
That's right.
So how do you know if you have varicose veins?
Well, varicose veins oftentimes are visible underneath the skin, but sometimes they're not. You may have symptoms such as swelling. You may have sort of a tiredness or an aching in your legs at the end of the day, and those can be signs of varicose veins.
So I've seen the lumpy ones when people have the big bulges in their legs and stuff like that. Show us what it would look like on this ultrasound here.
Well, the ultrasound will tell us if you have varicose veins, and there's certain criteria that we use to determine whether you have them. One is the size of the veins, and so we can actually measure the size of the veins with the ultrasound unit. We can also measure the amount of blood flow that's in these veins. And these things all go together to give us an idea about how bad your varicose veins are.
In the old days, y'all used to just rip them right out. And
That's
I thought,
right.
Don't we still need those veins?
Well, I'm a vascular surgeon. I did the vein stripping for years, and it's just a terrible procedure. About half of them return, and so that's not good. It's also very painful, a lot of time off of work. And that's the benefit of the new procedure, the Evlt. It takes about 20 or 30 minutes to do here in the office, and you can return to work or normal activity immediately.
So explain Evlt, what does that stand for?
The Evlt stands for endovenous laser treatment, and we actually use a laser to repair the valve that's broken inside the veins.
So this would be the laser?
This is the laser right here.
There's a little red light on my hand. Yeah,
right.
I can see it.
And we actually threaded it up inside the vein, and we can repair that valve. And that's the underlying problem. And so when we fix that problem, then the veins just go away.
So show us how you would do this procedure.
Okay. Well, we have our ultrasound here, and we would put the laser inside the vein.
Are you going to have to cut her leg to do that?
We just start a little IV on the leg, and so there's no incisions or anything. And we thread the laser up inside, and we go to where the valve is broken. We can see all this on the ultrasound. Then we turn the laser on, and as we withdraw the laser, it seals the leak inside that vein. And so it takes about 20 minutes or so to do, and then the patient can go back to work or go back to the gym or jog or something like that the same day.
So they are not knocked out during this?
There's only local anesthesia that's used. The patient's wide awake, and we just visit, and they just do great. It really doesn't hurt at all.
You don't need anybody to drive you or anything like that?
That's right. You can drive yourself home.
Amazing. Now, will you see the difference right away? Will the lumps go away and maybe any purpleness you had?
It really does. It works very well. You'll see the symptoms go away right away, the swelling and things like that, and then the veins will go away very quickly as well.
Now, do they stay gone, or will these come back?
They generally do not come back. It's less than 1% of the time do we have any kind of recurrence, so it's extremely successful.
Now, is this a health risk to these varicose veins, or is it just something that's kind of a vanity deal?
Varicose veins really are a health risk. They can cause blood clots, and blood clots can be pretty bad. In fact, people with varicose veins have a 9 times increased chance of a blood clot. So once we fix these veins, then your risk goes back to normal, and you don't have to worry about that anymore.
So I imagine insurance kicks in and helps out?
That's right. Insurance covers this because they understand the health risk, and it would much rather prevent a blood clot than actually have to treat one.
Now, we keep pointing out that women usually have this done, but it's a guy thing too,
It
right?
is. It is. It's more common in women. About 40% of women have this problem. Only about 25% of guys, but they definitely get them.
Well, it looks like she's feeling pretty good. She's still smiling there on the table.
Didn't hurt her too badly.
Well, thank you, Dr. Vanderpool. Sounds like a great new way to have your varicose veins taken care of for summertime, right around the corner.